If you're watching this video, you or a loved one is scheduled to have a procedure with Renown Health. This video will provide you with all the information you need to safely prepare for your procedure and stay comfortable and healthy during recovery. The following information is for your health, education, and safety. If you fail to follow these steps, your procedure might be delayed or canceled. You will receive a handout during your pre-admit appointment with important suggestions to help keep you safe during your procedure. You may also find this handout on our website at renown.org/explore/surgical-services. 2 weeks before surgery, please stop taking any vitamins, herbal supplements, and diet medications, including phentermine. If you're taking aspirin, medicine that contains aspirin, blood thinners, or have bleeding trouble, contact your doctor as soon as possible for further instructions about taking these medicines prior to your procedure. 1 week before your procedure, or on your doctor's instructions, stop taking any anti-inflammatory medication, such as ibuprofen or naproxen, but you can take Tylenol. Don't take any erectile dysfunction medications 48 hours before your procedure. Pain medications can cause constipation. If you already have constipation issues, we recommend you take over-the-counter stool softeners a few days prior to your procedure and through your recovery at home. And don't use any recreational drugs 48 hours prior to your procedure. If you're receiving any type of sedation or anesthesia, you must have a ride home. Please arrange for a responsible adult to drive you home and stay with you for 24 hours after your procedure. If you are unsure about your check-in time for the day of your procedure, please call your doctor's office. If you're sick, have a sore throat, cold, or a fever, notify your surgeon before coming to the facility. Do not drink alcohol after 6 p.m. the night before your procedure. Don't smoke or chew tobacco products, including e-cigarettes, after midnight before your procedure. Remove all body piercings and jewelry, including toe rings. If you're asked to remove dentures or partials, a denture cup will be provided. If you wear glasses or hearing aids, please bring them with you. Also, if you're on home oxygen and have a portable tank, please bring your tank with you. Wear loose-fitting, comfortable clothing that's easy to put on and remove. Fasting prevents the possibility of food or liquids entering into your lungs while you're under anesthesia. It's rare, but it can be dangerous, leading to infections, lung damage, and breathing problems. Fasting means not eating or drinking for a period of time. You will need to fast if you are having surgery or a procedure requiring any type of sedation or anesthesia. Because of this, it's vital to follow these and your doctor's fasting instructions. If you don't follow these rules, you can put your health at risk. Please be honest with your anesthesiologist if you didn't follow these rules, even if it was an accident. Don't eat solid food after midnight before your surgery. Also avoid milk or cream, even small amounts in coffee or tea. You may drink a total of 16 ounces of clear liquids up to 3 hours before your procedure starts. Clear liquids include water, clear juice, like apple or cranberry juice, black coffee, or tea without milk or cream, and sports drinks like Gatorade. Do not eat or drink anything during the 3 hours before your procedure. Patient safety starts with you. In fact, you're the most important member of your healthcare team. Shower or bathe with an antibacterial soap the night before or the morning of your procedure, and use a clean towel to dry off. To minimize infection risks, don't shave anywhere on your body 24 to 48 hours before your procedure. Put clean sheets on your bed after you shower, and don't forget to brush your teeth. On the day of your procedure, you'll be discussing the site of your procedure with a nurse and doctor. For example, if your procedure is on your right shoulder, your doctor will mark that site. If you're not marked on the correct site, please be sure to speak up. We encourage you to ask questions, participate in your care, and speak up if something doesn't seem right. There are a few simple things you and your loved ones can do to prevent infections and the spread of disease. The most important? Wash your hands frequently using soap and warm water. If you don't have soap available, use hand sanitizer. If you cough, cover it to prevent the spread of respiratory illnesses, and then wash your hands afterwards. Follow discharge instructions and eliminate germs from your home environment by disinfecting hard surfaces frequently. But remember, the number one thing you can do for your safety is wash your hands. Pain is normal after some procedures and surgeries. It might not be possible to completely eliminate pain, but we can manage it so you can get back to your normal routine as soon as possible. We use a pain scale of 0 to 10 to manage pain. 0 means you have no pain, 5 means you have some pain that likely disrupts some of your daily activities, and 10 means you have the worst possible pain. Please remember, we will do everything we can to make you as comfortable as possible while keeping you safe. You may be offered medication to treat your pain, but you can also use non-medicine treatments to help manage it. You have the right to learn about your pain management options and work with your team to find the best treatment for you. You can get effective pain management without prescription medication. Please discuss your pain management options with your surgeon or physician. Using ice or heat packs, massage, meditation, changing positions in bed, or simply watching TV or listening to music can be very effective at treating pain too. If you have severe pain that can't be controlled in other ways, you may be prescribed opioids. Opioids are highly addictive and can increase your risk of complications. They require a prescription and they should only be used at the lowest effective dose for a limited amount of time. Side effects of opioids may include sleepiness, dizziness, nausea or vomiting, constipation, decreased breathing, addiction, overdose, and even death. The risk of dependency increases after 3 days of continuous use. Dependency can develop quickly and easily. Don't feel ashamed, but talk to your care team if you're concerned. Keep medicines in a safe place out of reach of children. Never mix opioids with sleeping pills, over-the-counter sleep aids, or alcohol. Don't drive while taking opioids. Be careful at home as you may be more likely to hurt yourself or fall. Be aware of excessive sleepiness or decreased breathing as a sign of overdose. Arouse the person if you're concerned and call 911 if you're unable to awaken them or if their breathing is shallow, slow, or irregular. If you continue having severe pain, talk to your care team. You may be referred to a pain specialist. Your care team will discuss your ongoing care plan with you. Before you leave the hospital, you'll be given instructions for medicine, follow-up care, and prescriptions. When it comes to time for your procedure, here's what to expect. After you check in, you'll be brought back to your pre-op room where you'll begin to meet your care team. In pre-op, we will do our best to prepare you for surgery, and please remember, your care team will ask you the same questions many times to ensure your safety. It is also a great time for you to ask any questions you have prior to your procedure. We will work diligently to be sure all of your questions are answered. As you enter the OR, we want you to be prepared for what you may see and feel. The OR is very bright and can be very chilly. You will see your doctor and their assistants, other staff members assisting in your care, and the equipment needed for your procedure. Your care team will place your vital sign monitors on you for the anesthesiologist, as well as lower leg massagers. At this time, you'll drift off to sleep. When you wake up, you'll be in the P.A.C.U, or Post-ANESTHESIA Care Unit. These highly trained nurses will keep careful watch over you as you begin to wake up from anesthesia. Don't be alarmed if you do not remember much from this time period. The care team is here to be sure you are well cared for and ready to move on to the next phase of recovery. Thank you for choosing to have your procedure at Renown Health. If you have additional questions about any of the information in this video, please ask a registered nurse during your pre-admit appointment.